CEO of One True Health, is with us today, Shawn Smith. Shawn, welcome to the symposium. And if you could, let's start off with a little bit more about your background and One True Health.
Well, sure. And thank you, Stan. It's a pleasure and an honor to be here. My background, I've been in healthcare technology since the mid-'80s, selling patient care systems and IBM 3090 mainframes, which will show you all the gray hair that I have. But been in the health IT industry all over 35 years, and that's my background. This is my fourth startup company in digital health. So I have a couple of great co-founders that also have multiple successful exits within digital health. At One True Health, we are a digital health company based in Austin, Texas, and we're focused on putting patients in control of their medical records and their medical data. And we do so by providing both a full, accurate, vetted, complete personal health record from all past encounters, wearable devices, RPM devices, real-time health information, as well as past. And we consolidate it, make it accurate, and present it in a way that a patient can actually understand. And then we link that to a patient engagement platform. And that idea there is to provide actionable insights that keep a patient compliant on care plans and care instructions and help them to maintain their health and wellness. And we're also a HITLAB Breakthrough Alliance member. So proud to be part of the family.
No, seriously, your board membership there is tremendous. The leadership that you guys are giving, particularly with folks like Bill Toronto on the board and others, is just phenomenal. Let's talk a little bit about what's happening in the ecosystem. What you're seeing, sure, obviously, in the ecosystem is really important to this audience, and it's really going to focus for our conversation over the next 15 minutes here, 10 minutes, is patient engagement. You guys are so good at that. It's at the crux of so many digital health implementations, integrations into the ecosystem, and it's the core to making sure that patients are getting the full outcomes and the full benefits of a digital health platform. What is your secret to success here? You guys have seen tremendous uptake. Why are you seeing that? And what are you doing a little bit differently with patient engagement that maybe we don't see across all these other platforms?
Well, and I appreciate that question. There are certainly a lot of different solutions. I was at the ViVE conference that Bill Toronto was just at, and AARP, or Age Tech Collaborative Group, had a whole series of wonderful companies that were out there presenting new forms and ways of engaging with seniors. Everything from chat individuals to a unique platform to address social isolation and loneliness. These were all ways of engaging with seniors, engaging with patients. So as a company also in that space and providing digital health solutions to us, it means patient engagement means meeting the patient where they are. That's really what it's all about. And as a digital health company, we have to provide a personalized experience where they are, and to give a patient the information, the education, and the guided actions that they need in order to get healthy and to stay healthy. That's really what it's all about from our perspective. But there's a lot behind the scenes because, again, we've got folks that are involving in HIPAA compliant messaging solutions. There are folks that are using avatars now and in a leading edge way of engaging the patient. We're looking at more holistic view of assisting, our customers, our clinical practices, hospitals, senior living communities, and helping to provide an overall approach for care coordination in our way of delivering patient engagement. So that's what makes us a little bit different. That care plan compliance, involving the family members and caregivers, sharing data back to the healthcare practitioners, and doing so in a meaningful, coordinated way that keeps a patient compliant with their care plan instructions.
That's amazing. That really is. And when you look at some of the patient engagement metrics, what are some of the key metrics, some of the KPIs that you guys are following there?
Well, it's interesting. You've got a lot of people talking about quality in general and quality scores, right? And some are defining that as just patient satisfaction, and we'll send them a survey and we'll see what the results are. Or we certainly know all the different quality metrics and scores, especially for serving at-risk populations that ACOs and IPAs and hospitals and health systems are having to report. For us, it's really simple. It's whether or not it's sticky. Do they use it? Are they really truly engaged on a daily basis? Are we providing the value that they need that proves that they're using the system and they're getting accruing benefits from it? So it's really from, I'm very pragmatic, Stan, when it comes to whether or not you've got high quality, and you have high quality if you can demonstrate use of the system.
And we had a HITLAB had an executive salon earlier this month, and you were a part of that, and it was all about patient engagement and certainly the importance of patient engagement in value-based care. I mean, if it's not the most important thing, it's one of the most important things for value-based care to succeed. Talk a little bit about, you were in that session, talk a little bit about it, and talk about the folks that you connected with is some of the folks who were there, and some of the themes that came out of that discussion that really that resonated with you and all the good work you're doing at One True Health?
Well, let me start off by giving some props over to the way of HITLAB here. If you're on this call and you haven't really learned more about the Breakthrough Alliance, I highly encourage you to go. It's been a tremendously valuable partnership and relationship with HITLAB. And part of that was not only a heuristic analysis, really most detailed analysis I've seen in my career on the usability and the user interface of our products, but they also helped to conduct an executive salon. And that was, in our case, 25 C-suite executives, CEOs from hospitals, rural and urban, senior living community executives. We had high-level innovation executives from ACOs and health plans. Just tremendous audience. 25 people came in and they listened to us present on a new solution that we're coming in releasing in about 2 months, focused on patient engagement for seniors via a tablet platform. And we presented what our thoughts are, our assumptions, where we thought the market was, and then we went off into breakout groups. And these individuals provided great feedback, really common themes that we heard, Stan, amongst all 3 of the breakout groups that we had, related to just, how do they engage the patients in their own facilities, their own organizations? What are the challenges? What are the systems they are using? And how can we do it better? So, out of that, there were, if you don't mind, I'll share a few of the common themes that came out of that salon. First was, who were we really engaging? So, patient engagement obviously indicates we're engaging the patient, but in today's world, especially if it's a senior patient, and that was our focus for the salon, it's not just the patient, but it's also family members and caregivers who are likely there to assist the patient as they're coordinating their efforts and maintaining their care plan compliance. And those individuals have a lot of different needs and different requirements that we have to reach. So we have to be designing solutions for everyone within the care network and providing them specific and personalized views that will help that patient in their path to age well and to maintain their health and wellness. So if we know who we're really engaging, the second common theme was, where are you engaging them? And one of the attendees used a phrase I hadn't heard. He called it the home spittle, right? Obviously, we're doing a lot of home-based care now. 40% of American seniors didn't see a physician in person or through telehealth during the pandemic. And because of the workforce issues with clinical practices, hospitals, and senior living communities, patient engagement, just physically engaging the patient and bringing them back into the health system, is an issue right now for these organizations. So if we agree that there's a trend to more home-based care and people want to be at home, we've got people, have with the convenience of ordering products and services from their homes, what can we do to improve the patient engagement from the home? But, this creates a workflow issue. You've got appointment and scheduling. You have reminders that need to be given. It might be social determinants of health. What if this patient was food insecure or needed transportation? How is that arranged? How are the family members and caregivers involved? What kind of educational content needs to be delivered over to really make things happen correctly within that environment? And then finally, how do you engage the practitioners with that? So how do we do that in a home-based setting? Third common theme was, why will the patient engage with your system? And this really gets to the crux of it as offering a digital health solution. We all know it's got to be user-friendly and it needs to have a positive user experience, but it really needs to accommodate non-tech savvy people, as well as ones that are, you can't really assume that especially in a senior population, that they've got a smart device. And, my father-in-law still has a flip phone. So how do we engage patients where they are and give them daily value in the process? And then finally, the last theme was really a barrier to engagement, and that was trust. Really interesting to have that as a theme. People that view that the whole system is being financially driven. So therefore, how can we trust what you're doing? Are you just trying to dip into my pockets and bill for an encounter? Second is that the patient care process is often viewed by individuals as still being very cumbersome and time consuming. So if you're going to focus at home, what can the technology do to improve and address that issue of trust? And finally, can you assure that your privacy isn't being compromised? We all know the issues with senior fraud. We all know issues of just sharing data and exposing that data. How can you, if you're offering a new solution to a patient, assure them and provide that trust that their data is being protected? As you can see, incredible feedback from these C-suite members, and it's just a testament to the network that HITLAB has provided invaluable information and guidance for us as we completed the work on our solution.
No, that's super kind of you. Thank you for that. And again, the team here that puts those together is, just is incredible, and very passionate about what they do in terms of building these Delphi models of bringing experts together to help improve products, help improve ecosystems. And so certainly for those of you who are not familiar with heuristic analysis, it's one of the 37 different models that HITLAB uses as a part of their research toolkit to help generate evidence for startups around the world in a very efficient way in 30 to 60 days instead of sometimes 2 to 3 years. And so it is something that is important today more than ever because of the current funding environment. So, again, Shawn, thank you for that, really detailed and well-informed analysis of patient engagement, some of the key items there, and how it is making that difference and making that inroads into improving value-based care. And I think one of the things that we're talking about across all of the different programs that we run at the lab is certainly diversity, equity, inclusion, and we've been doing that for since the beginning. HITLAB was founded on the ethic of using digital to improve health equity. Now, 25 years ago, actually, this is our 25th anniversary. So the idea here is when you look at patient engagement, what is it about patient engagement that can help improve health equity?
Well, it's a huge, huge issue and problem. Even before the pandemic, lower income seniors and seniors of color were disproportionately affected with respect to access to care, and especially in rural communities. And we have customers that are in rural hospitals, rural clinics at One True Health. So that was before the pandemic. The pandemic just supersized that issue with respect to, you've got issues that are just incredibly focused problems with respect to people that live in lower income communities of just accessing care or accessing information that's going to give them, again, those actionable insights on how to maintain their own health at home, how to eat right, how to move, good hydration, sleep quality, stress management. I think patient engagement systems and solutions can find a way of reaching that population. And in fact, it's one of the areas where we're focused on the tablet-based functionality, because a lot of these individuals, lower income and seniors of color, don't have the actual infrastructure, the technology in their home. So if we're providing a tablet with 5G and unlimited data as part of that, we're giving them a platform to start fostering that engagement. So we're thinking about that very seriously at One True Health, but it's an area that needs, I think, a lot of focused attention and effort in order to arrive at the right kind of solution for those people that are desperately in need of access to care and access to actionable information.
Here. That's wonderful. Shawn, thank you very much. Just a tremendous amount of work, tremendous work that you're doing. Very impressive with what you've accomplished. Congratulations.
Thank you very much. Pleasure being here.